Buffalo safety Damar Hamlin is in critical condition after the Bills say his heart stopped following a tackle during the Monday night football game. That game is now indefinitely postponed. Hamlin collapsed on the field during the first quarter of the Bills game against the Cincinnati Bengals. Medics treated him on the field for nearly 20 minutes before an ambulance took him to a hospital. The Bills said in its latest release that Hamlin is currently sedated and listed in critical condition. Joining us live right now is Dr. Ryan Hollenbeck, a cardiologist from Mercy Medical Center in Cedar Rapids. And without knowing what Hamlin's doctors know, because we don't want to speculate here, what can lead up to or cause someone to go into cardiac arrest?
Yeah, thanks for having me. So cardiac arrest just means simply that the heart has stopped pumping. And usually this happens because of a dangerous rhythm disorder like ventricular fibrillation. And it's important to kind of separate what cardiac arrest is and is not. It is not the same thing as a heart attack. A heart attack is a blockage that causes part of the heart not to get enough blood. Now, certainly, if you have a heart attack, that is one thing that could cause a cardiac arrest, but they're not the same thing.
Are there any warning signs or symptoms for someone who might be at risk of cardiac arrest? I mean, in the case of Hamlin, you've got a 24-year-old seemingly healthy athlete. Can this happen without warning?
Yeah, there's a number of different things we think of, and certainly, you know, the population that I see are usually older adults, and so when someone comes in with a cardiac arrest, we think of things like heart attacks because they're more common in that population. When you have a young 24-year-old elite athlete, the list of things we consider are obviously different. The most common cause of cardiac arrest in young athletes is actually something called hypertrophic cardiomyopathy, which is a thickening of the heart muscle. And that could be asymptomatic, and the initial symptom could be cardiac arrest or an arrhythmia during competition. So that's the most common thing we think of when we have a young person who collapses during athletics.
Well, we certainly hope. We know these early hours are critical in the case of cardiac arrest. I'm sure you've heard this as well over the past several months. There are questions specifically regarding what happened last night or when a cardiac arrest happens to someone his age. If this could be COVID or COVID vaccine related. Again, we don't know Hamlin's medical history, but how do you address that concern that something like this could be tied to a vaccine?
Yeah, I think that's purely speculative. I mean, we know from a lot of data that the COVID vaccines are generally safe and well tolerated, and there have been cases of myocarditis reported associated with the vaccine, but those cases are extremely uncommon. And like I said, without knowing more about his individual medical history, you know, it's just hard to speculate.
If you have any kind of heart trouble, is this a warning sign for an athlete? Is this something that as an athlete that you can train to overcome and continue to be healthy in your goals?
Yeah, well, you know, it's hard to know because we're not sure exactly what happened, and so his doctors are probably, you know, actively working to narrow down the list of possibilities and figure out what's going on. But you know, the most important thing, like I always say, is to have a relationship with a primary care provider who listens to your heart on a regular basis and checks your labs and knows your vital signs and all those things. And having regular contact with a primary care physician is the best way to stay healthy and to prevent problems in general.
Absolutely. Dr. Hollenbeck, cardiologist at Mercy Medical Center in Cedar Rapids, thank you so much for coming in today.